Hello there. Come on, join us in. This is a good morning to be here at St. Paul's. My name is Spencer Chandra Herbert. I'm the member of the legislature for this community, Vancouver West End, and I'm really glad to be here joining you today. I see many people who've done many amazing things to help us in one of the biggest challenges of our time, the challenges of addiction, the challenges of recovery. And I want to say we just had a great tour and met some real heroes, people who go above and beyond to take care of people in our community at some of their toughest moments. And I'm excited about what we're going to hear from our presenters today. It's really hopeful, and I'm just really grateful to have a chance to be here with you all. So, some folks that don't need any introduction, but I'll do it anyways. I want to welcome and invite our Premier, David Eby, and our Minister for Mental Health and Addictions, Jennifer Whiteside, here to join us today, and they're going to introduce you to some of the heroes that work here at St. Paul's, and thank you for being with us.
Good morning, everybody. Great to see you all here today. I see some amazing people who work in addiction support and recovery in our province, real heroes of healthcare who are here today. Thank you for coming, and senior leadership from St. Paul's and from the board. I'm so glad you could be here with us today. Thank you, Spencer. Thank you, Mr. Whiteside, for joining today. We're on the territory of the Musqueam, Squamish, and Tsleil-Waututh people, and really important to recognize that, as well as recognize the disproportionate impact the overdose crisis has had on Indigenous people in our province, the importance of this work as reconciliation as well. We just got back, we just finished touring the beautiful new Road to Recovery facility upstairs that we'll be talking about today, and hearing stories from some of the physicians that work in that important facility. As I was coming back down with Fiona, the CEO here at the hospital, she was telling me a very moving story about saving the life of this new facility, saving the life of a woman who was here. She was one of the first people through, and her trajectory was to overdose and to death. Because she encountered the team here at St. Paul's, because she was able to move seamlessly through the Road to Recovery system. She's now back on her home territory, out at the downtown east side with friends and family who can support her in a recovery journey. This is the importance, and this is why we do this work. It's so important that when people make the decision, when they have that moment of clarity, when they're ready to change their lives, and they want to move into recovery, that they are greeted with support, that it's seamless from the moment they say, I need help, that they are carried through and supported every single step of the way. One of the problems we've had with our healthcare system in the province when it comes to addiction, in particular, is that when people have that moment of clarity, they're told, okay, but you need to wait, and we'll be able to get to you eventually, and that moment of clarity can pass. You can run into somebody you know, circumstances can change, or you can get quite sick, and that moment, that opportunity to change a life passes. And so that is the key challenge that's in front of us. The scope of the challenge is another one. The BC Centre for Substance Use tells us that the demand for these kinds of services is higher than ever, and 1/6 of the patients who come to St. Paul's are struggling with some kind of an active addiction issue. This is in addition to the more than 13,000 people who have died since we declared a public health crisis in relation to the toxic drug crisis in our province. But today is a good news day, because today we are marking and celebrating some really important progress on an initiative that we announced here just shortly after I was sworn in. Minister Whiteside and key folks from St. Paul's joined us. The Road to Recovery initiative recognizes the importance of seamless care for people when they're struggling with addiction. That to have the same clinical team supporting them all the way through each step in the journey instead of opportunities to drop off. There are 14 beautiful beds upstairs. These are detox beds for people who are the sickest, in the highest level of crisis, the most complex detox journeys that people have to go through. They need the most support. These used to be old research offices, and they've been converted over now into naturally lit treatment beds. The staff are excited and energized, and those are paired with 20 transitional beds that are part of this program currently in the community, so 34 beds. We've had more than 90 people go through this program already. The detox beds opened in September, the community transition beds in October, and already these beds are saving lives. We're going to have a conversation with some of the folks that are involved in delivering this care here at St. Paul's, and I'm looking forward to that. And I'd like to pass it over back to Minister Whiteside.
Thank you so much, Premier, and thank you so much for being here and for your support of this important work. And I do also want to just give a real shout out to all of the folks who are here from Providence, from Vancouver Coastal, the peers, the leadership. Everyone is so excited about the important work that is happening upstairs here for people who are struggling with substance use. We have terrific guests we're going to hear from shortly. Dr. Nolan, Cheyenne, and Ian are going to come and share a little bit about the work that they are doing in this program and how it relates to how we are, in fact, transforming access and the system of care to support British Columbians who are struggling with substance use. We know that the poisoned drug supply continues to impact families and communities across the province, and really there isn't a single community in the province that has not been touched by this crisis. And we've been working hard with partners in our health authorities, with our community service providers, to expand access for British Columbians. And I can tell you that the opportunities I've had to travel across the province, to meet with service providers, to meet with people impacted, people who are struggling, has been deeply moving and very impactful, because I will say that everywhere I have gone, whether it's been alleys in the downtown east side, alleys up in Trail, whether it's been mental health and substance use services of health authorities where people are moving mountains and performing miracles every day, whether it's been touring our service providers, what I see fundamentally happening is the utmost inhumanity in terms of how we are seeking to care for people who are struggling with addiction issues. And what we are unfolding here really at the end of the day is about dignity and about valuing the lives of every single person who needs the kind of care that they're getting here. So I'm very, very excited about the work that's happening here. This is really shifting, really transforming our system. And I'm going to leave it to Dr. Nolan to talk about just how Access Central is working and how some of these real paradigm shifts in our healthcare system are coming to be. But it really is about supporting people when they're in crisis, when they're coming in for detox, when they're coming in for withdrawal management, stabilizing them through that process, and then into treatment and into aftercare. And in a seamless way with continuity of care, the same people looking after them so that we don't lose them. We don't lose them in the gaps. And we don't have those waits that the Premier talked about. And so with that, I think, just to say a quick word about the sort of investments that we need to be making in our mental health and addictions substance use system of care in order to make this possible. In addition to, the significant investments that we made in Budget 2018, 2021, in Budget 2023, our government invested $1 billion to continue this work of building an integrated system of care where people have better access. And in this kind of the environment that we're here in acute care, but also in community, expanding access to free and low cost counseling, increasing our upstream interventions early with things like the Foundry centers, offering more in the way of medication assisted treatments to people. And we know that these are all key parts of the system. So thank you so much, everyone, for being here. And with that, I'd like to invite Dr. Nolan up to say a few words.
Good morning.
Good morning. How are you?
I'm doing well. Thank you so much for having me.
Well, thanks for joining us. Dr. Nolan, I think it would be helpful. You've worked in addictions for so long. You've seen so many different models. The Road to Recovery model here, meeting people with support when they need it right away. Can you talk about what makes this model different, or why it's going to be more successful from your perspective, or how it's working?
Yeah, absolutely. The Road to Recovery model was really developed by frontline clinicians and interdisciplinary care team, where over time our experience with patients really highlighted where we saw cracks in the system and how we could collectively come together to try and address those cracks to try and improve the treatment experience for people who were struggling with a substance use disorder. And so what we've done is sort of attacked that in two ways. The first is by increasing local treatment capacity through the creation of these new beds through Road to Recovery. But equally, and if not more impactful, I think has been the collective efforts that we've seen with Providence Healthcare, Vancouver Community, the Regional Addiction Program, all coming together to transform the experience of people when they are ready and willing and motivated to access substance use services. So what's different now is if someone calls Access Central, they can receive an on-demand comprehensive addiction assessment at the very moment that they're looking for it. And through that assessment, the interdisciplinary care team can determine what site or setting is most appropriate for management of their withdrawal. Not everyone needs to be in an inpatient bed-based service provider. And so trying to identify and triage people to the most appropriate setting will certainly maximize efficiency within the healthcare system itself. So not to say that if you don't need a detox bed, you aren't actually receiving treatment, because a huge proportion of this new health system redesign is to provide on-demand addiction treatment. So after completing that comprehensive addiction assessment, people can be started on treatment right then and there, and they can have a detailed follow-up plan be put in place for them. And for those individuals who are at high risk for severe, complicated withdrawal, we can now, for the most part, admit them to a detox bed for acute management of their withdrawal symptoms almost instantaneously. It is a huge transformation for the system. And beyond that, we have banded together to really support people at every phase along their recovery journey. So it's not about making sure people can have their withdrawal symptoms adequately treated in a detox setting and then discharge them back to either the streets or their housing, but rather to make sure that they are supported in the transition between detox, and if they are interested in accessing a bed-based setting for ongoing addiction management. And as you mentioned, really ensuring that there's a detailed and comprehensive aftercare plan available for people. So really it's a combination of increasing treatment capacity through the creation of these new beds, but also working with our community partners and the regional program to make sure that we're maximizing efficiencies within the system so that every individual who wants to access addiction care can do it at the exact moment that they're ready for it.
Whew. How's it working?
I mean, so far so well. I have to say there's been a lot of stories and anecdotes from patients who've been able to access not just the new beds here at St. Paul's Hospital, but the new experience of people when they call Access Central or they present to our Rapid Access Addiction Clinic. I think for the most part, people are finding it's quite a change, and in the most positive way. So we hope, as we continue to refine the model of care and to expand it, that people's experience in accessing substance use services continues to be a positive one, and that they can access the level of support that they need when they want to access it.
Awesome. Thanks, Dr. Nolan.
Yeah, you're welcome.
Yeah, appreciate it. Thanks for your work.
You're welcome.
Yeah, that's great. Thanks so much, Dr. Nolan. And now I'd like to invite Cheyenne Johnson, who's the Executive Director of the BC Centre on Substance Use. Hello, Cheyenne. Nice to see you.
Nice to see you both. Good morning.
Thank you also for all of your incredible work and the support of the BCCSU on this project. Can you talk a little bit about the role of research and evaluation in how this program's being stood up?
Yeah, I'd be happy to. I mean, obviously, from the BCCSU's perspective, from my perspective, being an academic health science center, research is so foundational for how we continually improve the substance use system of care. And if you really think historically, substance use hasn't been a part of our healthcare system. In the last few decades, there's been a lot of movement, obviously by this government, a lot of support to build new services and connections. But historically, there were community groups and faith-based groups that did a lot of that work. And so really in the last 30 years, the science of addiction has progressed so much. We know now what's happening in the brain. We have better medications that can support. We know more about behavioral interventions and recovery supports that can enable people to seek those recovery goals. I think the challenge is because we're still building the system, that evidence hasn't yet been integrated. And so that's really the work of the partnership with the BC Centre on Substance Use. Dr. Nolan and her team is to really build an incredibly comprehensive research and evaluation plan to support the incredible new clinical services here.
Yeah, that's great, Shan. I think that's an important observation that historically we've not seen care for people who have substance use issues as really part of healthcare. That's been really siloed. And so if you can imagine trying to break down all of those walls and build those connections between acute care services, community services, all of the other wraparound supports that are necessary, it's really actually quite phenomenal, the amount of work that partners are doing and in terms of how they're coming together.
Yeah, and I mean, if I could just add to, a lot of our work together is to try to create some parity between substance use and other chronic conditions. Yeah. And, if you come to St. Paul's or any other service, if you have cancer or you have heart disease, we can do laboratory tests and imaging and an expert clinical assessment. And we know if you have these factors or this in your blood work, this is the best trajectory for your support. And we're still building that evidence for recovery and treating substance use disorders. And so I think really the work that we're doing together is going to be foundational, not just here for St. Paul's, but really the rest of British Columbia. And you mentioned partnerships, so I really have to thank the provincial government for all of their support, not only to the BCCSU for this program, but also to some of our incredible donors that have supported this work, the Diamond Foundation, the Ronald S. Roberta Foundation, Peter Bull, the University of British Columbia, many other partners have come together to make this a reality.
Yeah, thank you very much for mentioning that. I did want to give a big shout out to the Diamond family and to the Roll Foundation as well for their important support of this work. Thank you so much.
Thank you so much.
Yeah. And I just say that a key component of any successful program is the peers. And Ian, thank you so much for joining us today. I'm going to turn it over to the Premier to have a chat with you.
Thanks for having me.
Yeah, thanks for coming in. Quite a day here.
Yeah.
You and I were talking before about the peer program and how important it is for people to have access to the peer program. Could you share with the media and folks who are here, why is it so important that people have access to peers? Why is this why have you been asked to build up this program and as part of this essentially medical program?
Yeah, for sure. So yeah, as a person who struggled with substance use disorder for a lot of years and found recovery ultimately, but it was really kind of by chance, and the right thing happened at the right time, and I was able to get to that place. But I think traditionally, or in history, like, it always hasn't been so open, and people have faced a lot of stigmatization, and as a result, they've lost trust in healthcare, and kind of lost faith in the system, and as a result, they stay out there for a long time. And I think a lot of times there exists a power imbalance. So when people walk in, they feel like they need to say the right thing in order to get the treatment that they need, And, when you have peer support come in, usually it's a person who has been where they are at, and they walk in the room and they start that conversation up. And immediately the person kind of feels a lot more comfortable, and they feel like they can be themselves. And then as a result, maybe they stay, maybe it works that time, because it is kind of like, it's great that Road to Recovery has come around and kind of gives that person an opportunity when they're ready, and then not only gives them that opportunity, but kind of walks them through the process, rather than like, okay, you come here and now you're going to leave, and now you got to wait for treatment here, and then they go back to the same place. But I think while they're accessing those services, to have that peer support worker is so important. And then for the team as well, right, to have that person to be able to contribute that has had that lived experience, and maybe helps the team to understand what that person is going through and maybe what that person needs. And then it's been my experience, even being in organizational meetings, I could give feedback to the team, and I just think it's so important. So yeah, the peer team's been growing here at St. Paul's in Providence, and I think it's fantastic. I'm really stoked about this Road to Recovery program, and I think that it's really going to make a difference.
Thanks, Ian. Thanks so much for building that team. It sounds like, it's just like someone that's in your corner if you're coming in to access these services, someone that's on your side. You might not have friends or family that are able to play that role, so now you've got built-in support and the peer worker. Is that kind of the idea?
Yeah, it's scary. It's scary, right? And if that person can feel comfortable, a little more comfortable, right? And, a lot of time our peers are people that come right from the community, and they're already well known to the patients, and it's just like a family-like feel, Yeah.
Thanks so much, Ian, for doing that important work, and best of luck supporting everybody on the recovery journeys. It's wonderful work. Thank you.
Thanks, guys.
Well, thank you. That wraps up that portion of today's announcement. But I really, just on my behalf, and I look out the window and I see all the people that I represent, and I think of all the stories that we have in this community of people who for too long tried to get assistance, struggled, tried to find a way in. And there for many, many years, there were no investments in this kind of work. There was a closed door to too many people who needed the kind of help that Ian and Shona and Cheyenne talked about. There wasn't the research done in to prove the efficacy of the work that we need to do. So I just really, I think of all those faces of all those people, and I think of all this important work that's happening here, and I know it's making an impact. I know it's making a difference, as you all saw here. And I just want to, on behalf of the people I represent, to thank the Premier and the Minister for making the investments, and to thank Providence and Vancouver Coastal Health and all those funders and volunteers and everyone to bring this here at St. Paul's, and then indeed out across the rest of the province that also need this work so desperately. So thank you. We're now going to move into the question and answer portion. I see Jimmy Smith here. He's ready to run that portion of it, and I'm sure the questions are not for me, so I'm going to stand over here. But welcome the Premier.
Thanks, Spencer.
Thank you for joining us today. We have members of the media on the phone line as well as here present with us. A reminder for those on the phone line to press *1 to enter the queue. All members of the media will be limited to one question and one follow-up. We're going to begin today with Emily Lazatin from Global News. Go ahead, Emily.
Hi, Premier. I have two questions. The first on this. It's already been successful. We've seen 94 people go through this program. Is the province already looking to expand in other areas when it comes to the continual care?
Yeah, thanks for the question. This program is already showing remarkable promise, and that's because it's been grounded in such a solid foundation of the experiences of the physicians, the nurses, the health workers, the social workers who do addictions work, and they say this is what we need. So there are an additional 50 beds that are going to be coming online next year. The full build out of about 90 beds actually, will be complete by spring, by March of 2025. That's just at St. Paul's. We're also looking at the potential of expanding this to a couple of other sites across the province.
Great. This one's from Richard Zussman. Are you concerned vaccine rates for flu and COVID are waning, especially as we start seeing cases of the flu going up?
Yeah, thanks. I certainly would encourage all British Columbians to go and get your flu and COVID vaccines. We're here at St. Paul's right now. Every British Columbian should be aware that our healthcare system is under significant strain. We do not need people in our emergency rooms who would have been prevented from being there if they'd just gotten a COVID or a flu vaccine. You don't want to be in our emergency rooms if you don't have to be. The way to avoid that is to go out and get your vaccines. I really encourage people to do that. You've gotten the notice, and even if you haven't gotten the notice, go talk to a pharmacist, any pharmacy across BC, talk to your family physician if you have one, nurse practitioner, and get those vaccines. Please stay out of the hospital. You don't want to be here, and we don't want you in the hospital. We need the space for other people, so please get your vaccines.
Our next question will come from Derek Penner from the Vancouver Sun. Go ahead, Derek.
Hi, yeah, this, I guess, is a needed, it's a very needed service, but when is the province going to release wait times for detox and treatment, as you've promised to do with an online tracker?
Answer that question.
Thank you for that, and we understand and are very committed to the evidence and the data that we've been talking about. As some of our guests spoke to, we have not had a system where substance use care has really been part of our healthcare system. So we have not had the same kind of reporting. We have a lot of partners that we work with in community across our health authorities, and we've been working with health authorities to gather that data, and it will be available and released in the coming months.
And Darren, do you have a follow-up question?
Yes, you've unveiled this today. You've made a commitment to 50 beds in the next year, but when can cities outside of Vancouver expect to get this same seamless detox to treatment service?
So this program will be fully built out by March of 2025 with an additional 50 beds coming on in the next year. We're right now looking at expansion to other parts of the province. I've been incredibly impressed with how St. Paul's has been able to stand this up so quickly. When you're talking about renovating a physical space to get it ready, the staffing and the teams, if you could see up there the number of people who are working to provide support and medically intensive care. I am hopeful that we can expand this quickly to other parts of the province. We've dedicated $1 billion in the budget to support this kind of addictions care, not just in the Lower Mainland, but across British Columbia. We also have 100 additional beds that are currently, the Canadian Mental Health Association is working with community groups to deliver, and more to come. I feel as much urgency as anyone to get these beds open to support people in recovery, and I know our health authorities are keen to get these beds open as well, so we'll move as quickly as we can, but I don't have a date for you right now. I wonder just quickly, Dr. Nolan, if you have anything about just the wait times or how people get into this program here, Road to Recovery.
Yeah, I can say...
Just wait for that thing to come down.
Oh, sorry. A little shorter than you. I can say anecdotally, we certainly have seen a shift in terms of the wait times in chatting with patients who have been admitted to the Road to Recovery unit or who have accessed outpatient care. What we're finding is individuals who are at high risk for complicated withdrawal are being able to access a detox bed much more quickly than they were previously. For the most part, people would have to wait on average between 2 to 3 weeks. We're now getting those people who need to be in a detox setting into a bed within 1 to 2 days. So it's quite a significant change. And then for those other individuals who don't merit an inpatient bed, we are linking them to addiction services at the exact moment that they call, either virtually or in person through one of our clinics.
Thank you. And our next question will come from Jennifer Maher from Radio Canada. Go ahead, Jennifer.
A bit of a different topic. Tomorrow is going to be Christine Sinclair's last international game. Any reaction about this last game happening tomorrow?
Well, I think all British Columbians are incredibly proud of Christine Sinclair and her remarkable run in women's soccer, and that she'll be playing her last professional game here in British Columbia. She's been an inspiration to British Columbians across the province, not just women and girls, all British Columbians and Canadians, and so we're incredibly proud of her legacy as a professional player, and I think we'll all be out celebrating with her what she's achieved in this last game of hers.
And Jennifer, do you have a follow-up question?
Will you be at the game?
I'm currently planning on attending the game. I hope to be able to attend. I understand tickets are going quickly, so if you were thinking about attending as well, you should maybe grab some too. It'll be quite a celebration.
Our next question will come from Michelle Gamage from the Tyee. Go ahead, Michelle.
Hi there. I'm just wondering what the age range is for people being able to access these detox services, because I've heard that there's no detox services for youth in BC right now.
Okay. These particular Road to Recovery beds are 18 plus. They're adult beds. But maybe I'll turn over to Minister Whiteside on the broader question.
Yeah, and maybe Shona, you can also just comment on youth detox. I mean, there's no question that we have challenges around particularly providing access to youth who need a different approach to services than adults do, and we're really learning that in terms of how youth are accessing the system and what happens when they wind up in an emergency department or where they're in primary care and they need to connect to services. So that is work that we're engaged in right now with some folks who are providing us some particular advice around scaling up services for youth and how to address issues around what is the best approach to bed-based services for youth. But Shona, maybe do you want to talk specifically about Vancouver and youth detox?
Thanks for that question. I mentioned a large part of the Road to Recovery work is around developing and strengthening relationships with existing community providers. So we do work very closely with places like Foundry to try and coordinate access to detox services. Youth in particular often don't necessarily require inpatient detox from a medical standpoint, because usually they aren't at high risk for severe complicated withdrawal, but many do require a transitional bed for stabilization purposes. And so we certainly, through our contracted beds, have the ability to offer them access to those, as well as to coordinate outpatient substance use care through the Rapid Access Addiction Clinic. So far, with the new Road to Recovery beds, we've seen about 10 young adults access those beds. So that would be between the ages of 18 and 25. And we know that they are a unique subset of the population with unique needs, and so we're refining our care delivery model to make sure that we're meeting the needs of them and other unique populations, particularly individuals who are pregnant or postpartum, as well as Indigenous peoples as well. So we're adopting a really interdisciplinary, holistic, culturally safe approach to care to make sure that anyone who accesses services through this new model of care can get what they need when they're looking to access it.
Do you have a follow-up question?
Just for clarification, so there aren't detox beds for youth in BC right now, but we're working on it?
We can get you a breakdown, Michelle, on background on the number of beds. I mean, there are absolutely places where youth are accessing detox. They're accessing it in different ways.
Next, we have to go to the phone lines. We have Rob Shaw from Check News online. Rob, do you want to go ahead with your first question?
Sure. Premier, just going on the idea of expanding this, could you talk a bit about how sustainable this model is, given that it required a sizable private donation of $20 million, and I think the Mental Health Ministry has spent 40% of its budget for new addictions treatment beds over the next 3 years just on this site alone. So how sustainable is it to expand this, and do you need to put more money into this area?
Thanks, Rob. I'll take a shot at this and then pass it over to Dr. Nolan. Big picture, when you talk about our healthcare system and our emergency rooms, the overdose crisis, the folks who are really struggling out there that need the most intensive care, have been cycling in and out of emergency rooms across the province for way too long. They'll come in with an overdose and be resuscitated and get stable, and then choose to leave because there's not further care that's immediately available for them that meets their needs. And then they'll overdose again in community and be brought back in. This is a very expensive way of responding to the problem, and it doesn't make that individual's life any better. Certainly doesn't make the community's life any better, and it impacts availability of healthcare for all other health conditions as well. And so the idea of this model is actually when you pull someone out of that cycle and you get them out of that overdose recovery back to community, overdose recovery back to community cycle, then not only is it better for that individual, it's better for the whole community, it saves money, and it's more humane, and it's ultimately more sustainable. So this is the direction that we have to go. Ultimately, it does require upfront investments. In particular, I want to certainly express my appreciation for the private foundations that did the work to support this. But government has set out $1 billion in the budget to support this kind of care. And we will dedicate the resources necessary to be able to ensure that we're delivering this kind of care. What we can't afford anymore is a system where everybody's kind of doing their own thing on a nonprofit model across the province. Nobody's talking to anybody else. There's no connection to service. A social worker here in the hospital spending all day on the phone trying to find an open bed. It's not a sustainable model. It will require upfront investment, but ultimately I'm very convinced that it will drive down costs and it will improve outcomes. But we do have the independent research to verify whether or not that's true. Dr. Nolan, do you have anything on this?
I'll just echo and say I really want to stress that what's different about this new model of care is not about building new things. It's about taking what is already in operation and improving efficiency. So really breaking down the silos between existing substance use services, bringing everyone to the same table and collectively working together to create a regional strategy, irrespective of whatever health authority it may be in, to make sure that there is a unified substance use system of care that is similar to any other chronic relapsing disease like cardiac care or kidney care or critical care. Irrespective of where someone in British Columbia is, at the moment they raise their hand, they know where to go to access services. And some of that may require capital investment for new beds, but the vast majority of the impactful work is really about that health system reorganization and improved coordination.
And Rob, do you have a follow-up question?
Sure. Thanks for that. Back to the Premier, could you update us on your consideration of involuntary care? I know you raised it, and there were concerns. Then you committed to sort of talking to different groups about it. Is it still on the table to hold people who repeatedly overdose, whether it's through this system or another system, or have you decided to not pursue that?
I think it would be fair to say that many British Columbians are concerned about someone who may be repeatedly overdosing, coming in and out of emergency rooms in the province, just waiting for that catastrophic brain injury or ultimately death. This is not a humane way to approach the issue. I don't care what your perspective is on harm reduction or recovery or any of these different issues. People living in that kind of hell, I would describe it as, they need support. I think it's fair also to say that this announcement today, this particular model, is an outgrowth of certainly my concern, our government's concern about these very individuals. I don't think that it's right to say, okay, well, the issue here is that we need to force more people into care if you're not able to actually offer the care on a voluntary basis to the people who are ready to go. And so this model aims to address the issue in a way that respects the individual's ability to make their own decisions, and for when they're ready, that the care will be ready for them. And it is absolutely critical, and we'll see, I'm told by people who are expert in this area, that one of the risks of involuntary holding of individuals, especially youth, is that when someone overdoses, their friends or they themselves are less likely to call an ambulance, less likely to call for help, and more likely to die. The goal is to keep people alive so they can get into treatment. So this model, I'm very hopeful, will respond to the issue that we've all identified. That someone, instead of checking out because they have to wait a week or 2 or 3 for detox, going back into community, trying to stay stable so that they can get into detox when the bed finally opens, instead are met with that support right away, immediately, when they come into the hospital with an overdose. And that way we get out of this discussion about voluntary and involuntary, we get into a discussion of the care is ready, and in fact, life is a lot better for you if you stay in the hospital, you get the care, there are peers here to support you, your life could change, and all the supports you need are here, and to have that positive conversation that frankly we haven't been able to have with people up to this point. So that's my sincere hope. It is a very challenging issue, though, especially around youth. And I know a lot of British Columbians are very concerned about it. I don't know. Do you want?
Our next question will come from Lisa Yusta from City News. Go ahead, Lisa.
Hi there. First, I'm going to ask a question on behalf of my colleagues at Omni. They are wondering, looking at Surrey, there was 5 overdose deaths the past week. The police put out a warning about it. Their question is, what is not working there, and what are the concerns specifically in that community?
Thanks. Yeah, really, we're talking about 13,000, more than 13,000 people who have died since the public health emergency was declared around toxic drug supply. And I think it's fair for all of us to ask what else can we do, what different models can we try, what different approaches should we take. And I welcome that kind of discussion. The disturbing news out of Surrey about 5 overdose deaths in 7 days. The drugs are still toxic. The drugs are still killing people. And really encouraging people to engage with the supports that are in community to try to minimize the risk of death. I think this is probably one of the most challenging issues the government has to address. And that's without even recognizing how hard it is to talk to the family and friends of people who have died of overdose. We're doing everything we can to keep people alive, to get them into treatment. Today's announcement is part of that. And these beds will benefit people across the Lower Mainland, including in Surrey.
And Lisa, do you have a follow-up question?
Yes, when talking about trying, everything possible, thinking back to Lisa Lapointe's recent and latest death review panel, there's criticism of your government for lacking the courage to follow their recommendation regarding expanding access to safer supply. Is that something that will be reconsidered in the future and perhaps after the next election? Because she talked about how this is something, years ago it would never have entertained her mind to take this kind of approach, but experts are telling her, and the death review panel came to this finding that is one of the solutions to help keep people alive.
Yeah, certainly as a government official myself, I can empathize with the coroner. She's got to talk to so many families who have lost loved ones, and she, like Dr. Henry, like Dr. Nolan, like so many people working on addictions, thinking about this issue. There are lots of different suggestions out there about what more we can do, how we can do better. I'll say this. If we find ways to keep people alive longer that will support them so they can get into treatment, we will do it. I have some really serious concerns about expansion of some of the programs that have been suggested by the coroner. But that doesn't mean that they're not possible. It doesn't mean they might not be effective. But it does mean that serious questions would have to be answered before they were implemented. And in particular, our government's focus has been on expanding recovery options, connections between physicians and nurses, people struggling with addiction, detox beds. We're already leading Canada on getting people out of that cycle of interacting with a police officer if they are in possession of drugs that they need not to get sick, so that they can be more willing to come forward and to ask for help. We're doing a lot of important and innovative work on that front. I accept absolutely there's more to do, and we'll work with the coroner and with public health and with addictions professionals on the best path forward.
Our next question, we only have time for one more, will come from Rob Buffum from CTV News. Go ahead, Rob.
Oh, hi. Thanks for taking my question. My first question is on behalf of a colleague, and it relates to bail reform with the House of Commons at the end of last week, accepting the changes to Bill C-48 that the Senate had proposed. They're hoping to get your reaction. Basically, what does this new bail reform law, what will they mean for people in BC?
Well, we've been pushing for a while for the federal government to amend the rules around bail, especially in the situation of repeat violent offenders. Someone who commits a violent offense, they're waiting for trial, and then they're released back into the community. We've had several high-profile examples that are very disturbing to British Columbians and frankly corrosive to their confidence in the justice system. It's not what was intended by the federal government's changes, but it has been the result, and so they need to fix it. It has been frustrating to me that it has taken so long to get to this point. These rules need to be implemented. They need to be available to judges so that they can keep people safe and make sure that violent offenders are not re-released back to community. I'm glad we're here. I wish it didn't take so long, and I'm hopeful to see the effect as soon as possible.
And Rob, do you have a follow-up question?
I do. It relates to an Abacus data poll that was released partially yesterday and I guess fully today that shows a continuation that we've seen in polls over the past several months with the BC Conservatives gaining traction. This latest poll released today shows that they are solidly in second place. The voters went to the polls today largely at the expense of BC United. And the BC Conservatives, in fact, in the North and Interior have a minor statistical edge over your party. I wanted to get your reaction to that poll and if you're concerned about the increase in popularity of the BC Conservatives.
Well, thanks, Rob. Polls are going to come out between now and the fixed election date in October. And I don't think there are a lot of British Columbians who predicted where the polls would be today 6 months ago. And we're 6 months out from the next election. So that's a long time in politics. We'll see how things shake out. I'll say this about the Conservative Party, and British Columbians should be aware that this is a party that denies the existence of human-caused climate change. They question whether or not vaccines are effective. This is a party that is anti-science. This is a party that has some of the worst traditions of populism from the United States that have ripped that country apart. And so if people are thinking about their vote for the next election, they should know those things. And certainly I understand some of the federal debates back and forth between the parties showing up here in British Columbia. But in terms of our reality in British Columbia, the lived experience of British Columbians, driving each other apart over differences, the culture wars, getting people wrapped up that teachers and librarians are the biggest threat to our children in schools, when that's clearly not the case. Questioning the science of vaccines and of climate change and our need to take action on that. It's not helpful for us as a province. It won't help us grow. It won't help us be successful in the world. And actually, it'll take us backwards very significantly. So I encourage people to look at those actual real beliefs of the Conservative Party of British Columbia when they cast their vote 10 months from now. And that'll be 6 months from now. 10 months from now? 10 months from now. And that'll be part of our message to people as we move forward.
And that's all the time we have today. Thank you so much for joining us.